COVID-19 vaccinations have caused mixed feelings among Namibians even before their introduction in the country. In March this year, when the first jabs of Sinopharm, the Chinese vaccines, arrived in the country, anti-vaccine sentiments were shared broadly as a means to spread public fear, despite researchers calling out the misinformation. By Saturday, 67,593 people had taken the first dose of the vaccine, while only 8,777 received the second dose.
Remember, there was a story about 3 weeks ago of a patient in Namibia who got the vaccine, a 62-year-old gentleman who died the same day, later on in the day. I've still yet to see the autopsy results or the conclusion that yes, it was related to the vaccine. But let's say it was, right? We've already vaccinated about 62,000 people and we've had potentially one death. We've had about 50,000 infections in the country and we've had 600 deaths. So that's your choice, essentially.
Among the myths making the rounds include claims that the vaccine is a means of population control. Others have claimed the vaccine has left them magnetic. More misleading information concerns alleged infertility and erectile dysfunction in men.
It's going to cause infertility. There's no evidence of that. The way the vaccine works is just to stimulate your immune system to attack COVID should it come into your system.
Researchers encourage the public to search for reliable information online when looking for COVID-19 related information rather than solely depending on social media.
Johns Hopkins University's coronavirus pages, which for me provide some of the best and simplest and elegant explanations for a lot of vaccine related information. They have a very good page there and blogs around why the COVID-19 vaccines have been able to emerge so fast. It gives very simple explanations about the technologies, the processes, how and where processes were sped up for trials and so forth. So, I mean, the credible sources are out there. It's just that people don't actually click through to those links.
Those sharing unverified information around the vaccination should discontinue from doing so, Link says, as coronavirus deaths continue to rise. The Health and Social Services Minister Dr. Kalumbi Shangula announced that hospitals are currently full as the number of new cases progressively increases on a daily basis.